Milestones, landmark trials in cardiology. Few trials have changed clinical practice as directly as MADIT-II, which fundamentally altered the approach to prevention of sudden cardiac death. When the multi-center automatic defibrillator implantation trial 2 was published in the New England Journal of Medicine in 2002, the central question of MADIT-II was both simple and bold. Could a reduced ejection fraction alone identify patients who would benefit from a primary preventive defibrillator? MADIT-II built on the earlier MADIT trial, but deliberately moved beyond complex arrhythmia testing. Instead of requiring non-sustained ventricular tachycardia and inducible ventricular tachycardia, MADIT-II used only one marker, an LVEF of 30% or less after myocardial infarction. This cutoff was not an obvious decision. There had been discussion whether cutoff should be 35% or 30%, and whether additional markers such as non-sustained ventricular tachycardia or a wide QRS complex should be required. Ultimately, the investigators decided that an ejection fraction of 30% or less would suffice as the single qualifying risk marker. The trial randomized 1,232 patients in a 3:2 ratio to receive either ICD or conventional medical therapy. The primary endpoint was death from any cause. After a mean follow-up of 20 months, all-cause mortality was 14.2% in the defibrillator group and 19.8% in the conventional therapy group. This corresponded to a risk reduction of 31%. The survival curves began to separate after approximately 9 months and continued to diverge thereafter. The result was consistent across clinically relevant subgroups, including age, sex, ejection fraction, New York Heart Association class, and QRS duration. The importance of MADIT-II was not merely that an implanted device reduced mortality. Its importance was that it changed the logic of prevention, shifting it from a reactive to a proactive strategy, opening the door for primary prevention of sudden cardiac death. MADIT-II changed guidelines, clinical workflows, and the everyday evaluation of post-MI patients with LV dysfunction. In summary, MADIT-II transformed the prevention of sudden cardiac death.